Webinar will discuss how community advocacy and collaboration led to policy change with leaded aviation gas at a San Diego airport. Dr. Nguyen is the co-founder of San Diego Pediatricians for Clean Air and a Kaiser physician. And Riley Gilbertson is an advocacy intern with San Diego Pediatricians for Clean Air and a medical student. At the end of the presentation, our presenters will be available for questions, and a recording of the presentation will also be available on our website, which is listed on the right-hand side of the screen. Recordings from the other presentations throughout the week will also be posted to the site. And with that, I will hand it over to Riley and Dr. Nguyen to begin the presentation. Thank you.
Thank you, Jessica, for that introduction. So my name is Riley Gilbertson. I was born in San Diego, went to school for undergrad at UCLA, and then I just started at Vanderbilt a couple months ago for medical school. And Dr. Nguyen, do you want to introduce yourself as well?
Hello, my name is V. Nguyen. I am honored to be Riley's pre-med mentor, and I am a frontline pediatrician at Kaiser San Diego at Otay Mesa, and the founder of San Diego Pediatricians for Clean Air, and do a lot of crazy climate work as well.
All right, so today we'll talk a little bit about kind of the intervention that Jessica alluded to. So really what we did here was kind of addressing the leaded aviation gasoline at a specific airport called Montgomery Gibbs Executive Airport in San Diego. Next slide, please. So we will talk about exactly that, why we got involved, what we actually did, and what happened as a result of all this. Next slide, please. All right, so first off, like why this is important. And I think for the attendees at this specific session, this maybe is not the most important thing for me to stress, but San Diego, and I'm sure everyone feels this way about where they're from, it's a very special place. And so preserving the health of its environment, and especially its people and its communities, is really, really important. And so why this is important is because the leaded aviation gasoline that was used at this airport, and that's used at other airports in California and across the nation, represent an imminent danger to the health of thousands of young San Diegans. And because of the way lead works and the way lead poisoning works, and we'll get into this in a couple slides, there are ramifications that can take place, not just in an acute setting, but more likely over decades that are really hard to measure and to see the manifestations. And so we'll talk about that. And then we'll kind of take a step back from that individual level of kind of how this is harming the potential of children, and talk more about kind of, well, from a societal level, kind of what's the impact there. Next slide, please. And so first, kind of to give some background in terms of kind of what is going on with the airports, and is there any connection between the lead and the gasoline and raising the level of lead in the blood of the children beneath the airport. We relied upon this study done in Santa Clara a couple years ago. And that was done on the Reed Hillview Airport, which has since been shut down. But they conducted a study where they measured the blood lead levels, or BLLs, how much lead is in the blood of children at varying distances from the airport. And what they found, in short, was that yes, the use of leaded aviation gasoline directly causes an increase in the blood lead levels of children near the airport. And so that kind of made that first connection of, okay, yes, this lead in the gasoline has been confirmed to be finding its way into the blood of children below the airport. That airport was ranked 34th in lead producing airports for airports in the United States. It produced 745 pounds of toxic lead emissions. The airport we were addressing in San Diego produced almost 1.5 times more lead and was ranked 11th in lead producing airports. And then importantly as well, because lead is something that manifests over decades, and especially in developing children, if we look at a population using kind of census data, the population within a mile radius, there were 6 schools within a mile of MYF. There were 900 residents under 5 years old. And then there was also concerns of environmental justice or injustice. 55% of the population belong to racial and ethnic minority groups, and 29% are classified as low income. Next slide, please. Okay, so if we've established then that lead from gasoline is going to find its way into the body of children, the natural question is, okay, well, what is this lead doing? Is it bad? Again, probably not a rhetorical question that needs answering in considering the group, but lead is kind of unique in the sense that it occurs a lot in low exposures. It's often asymptomatic at the time of exposure, but the evidence for harm, even at these low levels, is very, very well established. There are multiple neurological outcomes and other health effects across a multitude of organ systems resulting from blood levels below 5 micrograms per deciliter. And the biggest one I think that we'll address, and you can see a laundry list here, but the biggest one that we'll address and the one that has the most deleterious effects is likely the reduced IQ, which has, again, like these long-lasting potentials. And so to illustrate that, we'll look at a little case study on the next slide. So this is just a graphic that kind of helps us understand. I think we've talked about what can happen at the individual level. Neurological symptoms and more acute symptoms and manifestations of lead poisoning. And that's pretty easy to visualize and understand from the perspective of, your niece or your nephew or your child, that, it's understandably very frustrating for them to be experiencing these symptoms through no fault of their own. But if we take a step back and look at, well, what's the effect on a population level? Here, what they did was they had an imaginary unaffected population of 260 million people. The average IQ in this case was 100. And so that left us with, 6 million people below an IQ of 70 and 6 million people with an IQ above 130. Below 70 would be considered intellectually disabled, and above 130 would be considered gifted. If we just take a modest IQ reduction from, say, something like lead poisoning of 5 points, you shift that curve to the left, and now you're multiplying the amount of people that require social safety spending below 70 IQ by 1.5 times, and you're reducing equally the amount of gifted people. And so I think this just really goes to show that, even a very modest form of IQ, which is not going to prevent any given individual from leading a very normal life, on a population level, it's really, really deleterious and harmful. Next slide, please. And then this, again, from that same lens, what's the economic cost here? I was an economics major in college, and so I think this lens, just provides a different way to view things and the effect that this is having. I'm not going to go through all the different costs here, but I think the most important one, again, that we mentioned was IQ loss. This was a study done that took a cohort of children, and it kind of estimated what would the cost be, kind of assuming that level of lead pollution, what would the economic cost be for that cohort of children, and the IQ loss itself was estimated at nearly $300 billion. Next slide, please. Okay, so we've established that lead is bad. Lead is bad for individuals and for society as a whole. And then we've also established that the lead in leaded aviation gasoline or avgas causes an increase in lead in those under airports. So now we'll kind of transition into how we became aware of what was going on at this airport, what we actually did, and we'll categorize that in 3 main ways, which is public awareness, academia, and government. So just a brief aside on how we became aware of the issue. There was an organization called Montgomery Gibbs Environmental Coalition led by Sandra Stahl, who was a valiant community activist, and she was pioneering this effort for months and months and months, and I believe years before we even arrived on the scene. And so really how we became aware was she reached out to us and set the goal of trying to establish a unleaded fuel tank at the airport. And that's as simple as the solution was just getting the budget approved that would include that funding for that unleaded fuel tank. So that's how we became aware. And from there, it was really just about supporting her and kind of taking initiatives on our own. Next slide, please. And so here we have kind of the 3 main categories and some of the things that we endeavored to do within each of those. So within public awareness, our goal really was just to let people know. I think neither Dr. Nguyen nor myself had any idea that this was going on, nor the effects. And so I think our first goal is really just to let people know. And so we did that through an op-ed in the San Diego Union Tribune. We attended various town councils, and that was just really productive in kind of interfacing with the people who were actually being affected. And within academia, we wanted to not only kind of spur awareness in the scientific or academic community, but also action. And so we presented to medical students at UCSD at the program in medical education and health equity. We presented at the International Conference on Children's Health and the Environment. We presented a poster presentation at the Pediatric Academic Society. We published a paper in the Journal of Community Health. Dr. Nguyen gave a Kaiser TED Talk. So really they're just kind of, I think we were hoping to get activity from and inspire advocacy from the academic community, because I think, aside from a very small portion, not many people are aware of this issue. And I think raising awareness is a great way to kind of get the ball rolling in terms of action. And then the last was just the most direct in terms of trying to persuade local and regional policymakers. So we wrote letters to the San Diego mayor, the administrator of the Region 9 EPA. We testified at the City Council Rules Committee and various budget meetings and City Council meetings. Yeah, and then next slide, please. And then in terms of timeline, because I think that all seems quite nebulous in terms of, when did that happen? How long does that take? What's kind of the involvement there? This started in late 2021 in September when we received that contact from Sandra Stahl. And then over the course of about 9 months, we advocated, testified, and this was not a daily thing. This wasn't some huge involvement that, occupied our life. We definitely were thinking about it quite often, but we were not chaining ourselves or doing anything crazy. We really just were showing up and speaking our mind. And that took place over 9 months before the budget was ratified in June of 2022. Next slide, please. So kind of with all that said, I think from the perspective of someone that, at that point was 21, just fresh out of college, a little bit apathetic and disheartened about the way of the world, as I think many people are, I think this was a really inspiring thing to be a part of. And I think one thing that Dr. Nguyen really kind of says, and I think is so true, is that advocacy really is about showing up. There are so many things out there that can kind of feel overwhelming, and that there's so many things to address. But if you just take the step and show up, you are doing more than 99% of people. And policymakers and lawmakers see that. And it's really quite possible to make change, even as a group of 1 or 2 people. So I think that was my biggest takeaway. And with that, I will transfer it over to Dr. Nguyen.
Thank you so much. Next slide. So my name is V Nguyen. Next slide. My name is V Nguyen. I'm so happy to be here. I think this is probably, I don't want to say the last time, but it's kind of our graduation, right, Riley? This is such a beautiful project. I was so honored to be a part of, and it was just so serendipitous because I actually met Riley, and I'm Dr. Plastic Picker on Instagram. If you want to follow me, I'll talk more about that. But I actually met Riley when I interviewed him for Harvard College, because I'm a Harvard alumnus of the medical school and the undergraduate, and was he just impressed me. He was ASB president, well-spoken, charismatic. I just really liked this kid. I was just just one of those connections you make, right? And I basically was saying, just keep in contact with me. I know you're going to do great in life. I think Riley had been waitlisted at Harvard, and I actually have gone back to the environmental health people at Harvard and said, that was the biggest mistake you guys ever did, not admit him, because he's since been on fire, So, and then Riley reached out to me. He reached out to me about 4 years later and said, Dr. Nguyen, I went to UCLA, did fantastic. And he didn't say fantastic, but I could see that he did fantastic, and was like, I actually do want to go to medical school, because I shared with him my experience as a pre-med advisor at Harvard. And then that was actually the same time I had started doing advocacy work. So it was kind of this meeting of minds, and we had this trust with each other because I had really liked him and believed in young San Diegans, and that I told them probably the best thing about Harvard was just I was an advisor for a lot of kids, and if you want to go to medical school, let's try to do it together. So next slide. So that's me, V Nguyen, a little bit about my background. So I have a lot of titles now. When I actually met Riley, started doing this work, I didn't have as many titles. But since what I've realized is that titles do make a difference. And all these titles, it sounds like a lot, but they're all volunteer. I don't get paid for any of this. I actually, I'm a frontline pediatrician at Kaiser. I used to be assistant chief, which I did kind of, so I have been admin, which is why kind of talks some of my burnout story. But I'm officially chair now of this AAP California State Government Affairs Expert Committee on Climate Change and Environmental Health. So all the legislation that goes through if AAP endorses, like AB 249 on leaded drinking water, all that stuff, like it goes through our committee. So I am one of the two chairs of that committee now. I'm also the chair of the Public Health Advisory Council Climate Actions Campaign, founded San Diego Pediatricians for Clean Air with about 50 other pediatricians and pre-medical students. And at Kaiser, I have the title of Sustainability and Green Team Lead. So, and this is me, very happy on Instagram. I'm just happy, which I love this picture. I'm like biking in Oregon on the beach, and I've never been on a bike in a decade, or like 20 years or something. Next slide. So yeah, so I am on Instagram. It's a little funny. I'm happy to have you follow me. I actually have real followers. My brother's corgi has 10,000 followers. I am a litter picker, plogger. So that's people who jog and pick up trash at the same time. It's actually a thing. You know, Instagram has every niche community. That's my niche community. So I really am interested in trash. I do trash art. I am actually probably past 1,000 bags of trash. But I stopped counting because I don't want this journey to end. So these are just some of the pictures I post. Okay, next slide. But I'm not as popular as a corgi. So I am a trash artist. I like, it's kind of funny, but it really makes me happy. I sometimes incorporate things from what I find. Sometimes it's clean trash, but it really expresses how I'm feeling that day. And this is my recent trash art. You can say I'm very happy. And I'm a pediatrician, so a lot of my trash art looks like toys. I use the hashtag trash artist, artivist, upcycled life. Next slide. So I think it's funny. So San Diego Pediatricians for Clean Air, what happened? So we are this coalition of we're actually going to be a 413B or something. I'm going to finally do that. We're just a website with a bunch of friends. But what I realized is all good things happen because of organic connections. So these are all friends who are pediatricians in the area, pre-medical students, and we just wanted to do something. Like we saw this existential crisis, mostly on climate change, but also on lead pollution, vaping, these issues that seem so common sense, right? Get lead out of fuel. Vaping, actually, there should be not flavors in vape products. So these common sense issues that shouldn't be partisan that we wanted to kind of address. So most of us are actually part of the American Academy of Pediatrics and departmental leaders. And I just remind everyone that, yeah, corgis are really famous in San Diego, is that, you know, in pediatricians, for us, like I always wonder why pediatricians are out in front in a lot of advocacy. And the reason why is everything that goes bad in the world affects kids more, right? So lead, because kids have smaller bodies, they absorb more lead, they're growing. So, I mean, as pediatricians, it's affecting everyone, you know, the police force, because leaded bullets and aviation fuel, pregnant women, everything, but it always affects kids more. So I think that's why pediatricians have been out in front and should continue to be out in front. And for pediatrics, as you know, prevention is in our DNA. I'd rather prevent something than have to like cure it, right? So we just had a very sick patient in our code room. Usually they're asthmatics. You know, I'd rather deal with air pollution, right, than have to have more kids in my code room. And also with lead, that was a fundamental thing for me because I treat a lot of autistic patients, and I have a lot of kids who are from Claremont, around the area, who happen to be Vietnamese because I speak Vietnamese, and they all come to me. So when I heard about the leaded air pollution in Claremont, neurodevelopmental issues, I wasn't an expert on it, but I was like, that affects my patients. So I had to kind of show up for that. So that's who we are, San Diego Pediatricians for Clean Air. Our logo, which one of our other pre-meds, who's our founder, did. So it's very homegrown. We do have a website, which someone maintains for us out of the goodness of his heart. Okay, next slide. Yeah, so I tell everyone, like, there is no budget. Like, this whole thing is like $20 a year, right? Because I want to make it a transformational relationship between us and the pre-medical students in the community. It's not transactional. This is all on our own time, which for me, I need to have that be volunteer because it comes from our heart. So the brief story is that I was assistant chief of pediatrics, have finished my term 5 years, very kind of left on good terms. Organization is wonderful, supported me. But through the time of being assistant chief during about the first year, I totally burned out. A very complicated story about burnout. I'm sure there's a lot of clinicians on this line and just everyone, I think, in the world now. I mean, there's a lot of sadness. You know, the climate crisis, you know, COVID really took a hit on our society. A lot of pain. And for me, it was a very specific moment when I had 2 toddlers that actually got cancer the same summer. And they let me share the story. And then they were both the babies in their families. And one died that summer, and it just really affected me. I don't know, it's hard to know why, right? I've dealt with death before. I'm a pediatrician, but I just got really sad that summer. And that is the same summer that, and all of us have gone through issues like working mother, especially a lot of physicians. We've delayed a lot of our lives to kind of do what we do. And I completely burned out, almost left medicine around the time this was all happening. And then it was the same time the climate marches were happening. The kids were Greta Thunberg. I think a lot of youth were getting activated. A lot of people in Riley's generation. And then the true story is I just started picking up trash on the beach. I mean, that's an honest true story. I'd never been on Instagram before, got an Instagram handle, started picking up trash, going early in the morning, showing them pictures of my trash, and just became this like really happy person because I was out on the beach early in the morning and just like slowed my mind down. So if you ever want to pick up trash, let me know. I do still take groups out. It's very therapeutic. Yeah, and I got better. And I tell people I was the hamster on the wheel, like all of us, the hamster on the wheel. Harvard College, Harvard Medical School, assistant chief, thought I was doing well, had good numbers, metrics. Lead was one of those metrics we were after, which is why I kind of knew about lead. Hit the numbers, got awards, right? But almost left medicine. Like, you don't know people's pain unless, you could look like you're functioning, right? But I was not functioning. But then after kind of getting on Instagram, picking up trash, I got off. I'm the hamster that got off. And I still work. I actually am probably the happiest pediatrician around these days. I mean, my patients, the ones who knew me before, I mean, they knew me, but now they're like, Dr. Nguyen, you're just different. I practice differently. I'm much more mindful. I'm very present for my patients. And then, so what we talk about in climate work and environmental health, and I do want to concentrate on lead, is that when you do this work, it has to be the intersection of what are you good at, what brings you joy, and what work needs doing, right? So this is all volunteer. So what am I good at is I love making noise. I actually like speaking. I'm irreverent. I didn't realize that by myself, but then you look at my trash, or you kind of get it. What brings you joy is hanging out with people like Riley, surrounding myself with people who really build me up, give me good energy. And I think this is the most important thing. What's the work that needs doing? I'll be honest with you. I'm speaking as a frontline pediatrician, as myself. And there's a lot of nonsense out there. Like there's metrics. All of us have numbers, right? And there's someone who decides that number is important. I had been there as assistant chief. And if you actually ask my supervisors, I was the one who brought our department beyond all the metrics. Like we were hitting every single number, right? But it wasn't sustainable. And plus the question wasn't important. So for me, when I got off the hamster wheel, I had to rethink everything. The climate crisis actually taught me that. And lead was one of those things, because to me, I was like, this is ridiculous. This is silly. Like, we can't even get the lead out of aviation fuel. Like, I'm, as assistant chief, was trying to hire a developmental specialist. There are not enough developmental specialists in the country to deal with the developmental issues we have. And the idea that a fuel tank that only costs $170,000 was not getting done, where the downstream cost for us in the healthcare system was like millions, was to me just, so the work that needs doing, that part I think is very transformational, because at some point I decided that I had the agency as an MD, as a frontline decision, to decide what am I going to do on my free time. Next slide. So yes, and so basically this is our mission statement, which was made by our students. And these are just example. We have about, I kid you not, I know, Riley, you've been cloned like 20 students now, right? And so a lot of them have gotten to medical school and on the different pipelines. We try to take only UC students, so it's really UCSD. Riley's the one we had from UCLA, and then we have Berkeley now, just because my son's up at Berkeley. And so the students have been really transformational. And what we try to do is we try to have these authentic, manageable projects that they can do, because a lot of them are actually environmental justice students from environmental justice communities. They have to work for their tuition money. They don't have time to do meaningless tasks. So I try to get impactful things that they can do that will make a difference, that'll help them on their journey. So Vivian was our first student who actually was ended up at Harvard Medical School. Riley is our second student at Vanderbilt. And so there's a whole cadre now of students in the pipeline. Next slide. And then, this is something that actually, it's funny, I just kind of do what I need to do, and lead is one of those. So if you want to reach out about lead through the AAP aviation fuel, leaded drinking water, I'm there for you, because I actually like, this is my thing now, right? Other than climate work. And, but what I realized, if you just do what you need to do and what's right, it will come. It will come. And so I have been doing this for about 4 years. I've been on a lot of podcasts. I've been to the World Economic Forum, all these things. But then what happened is I just got dropped in our local paper, the San Diego Union Tribune, as kind of an Asian American leader. And the article was so beautiful. And it actually was a student that wrote the article about me. It was a high school student that won our Green Ribbon Award that we made from our Climate Change and Health Committee. And this student is like, Riley, amazing. You know, this kid's on fire. He has his own NGO, and was doing a journalism fellowship and asked if he could interview me. And I can tell you, it wasn't so much that it was the San Diego Union Tribune, because that was wonderful, but it was the article, it was his writing, it was his storytelling. And this just dropped just this month. And I've just been getting all these offers from, you know, can we podcast you? Can you do this? Can you do that? So I just want to say that mentored voices, especially youth voices, are so powerful because it's their future, right? And so I always go when I speak at pre-medical societies and students, and I tell them the truth is that our generation, my generation, for anyone in their 40s or 50s, like we messed up, right? Like we should have been doing this like decades ago. I don't know where I was. I was having kids and trying to balance being an MD, 2 MD couple. But yes, youth voices are very powerful. Mentored voices are powerful. And so Kyle Tianchi, who's a senior student at Cambridge School in San Diego, is one of those students. So I think he reminds me a lot of Riley. Next slide. And then the importance of creativity. So as Riley said, you know, this Sandra Stahl was this woman who had had a whole coalition trying to address this, right? But these were community members, and they really just reached out to us, right? It was just a random email, and I got the email, and I just kind of called Riley and saying, Riley, I think this is really interesting. I don't actually know a lot about lead pollution other than what I learned in residency, but I think we can figure it out. And so this is just a picture for one of our art shows, but a lot of this, everything we did has been about creativity and connection. And so I have to give a big shout out to one of our co-authors is Elizabeth Friedman. So it sounds kind of crazy, but because I'm a trash artist, Elizabeth is one of the pediatric environmental health specialty physicians in Kansas City, Missouri. So she's PACES, right? I have since met the California folks. So I know Stephanie Holmes and everyone now. But honestly, Elizabeth just really liked my trash art. And so she reached out to me and we just became really good friends. And what I realized for this project is I just reached out to people I trust. And Elizabeth gave us all the information about lead pollution. She mentored us through when we need more specialty information. And so she's one of our co-authors of our paper and a good dear friend now. I know who other people to go to, but you know, we still collaborate on a lot of projects. But like being creative, reaching out to folks, and the stuff, you know, in the end of the day, like I still am amazed that we got it done, but we got it done, right? And we just used what we had, and we were just trying to be super creative with advocacy. Next slide. And then in terms of talking things up, so I always tell the students, like, you know, you do it, it's important, but you also have to talk it up. You have to show the next generation how to do it. So anytime there are opportunities to this, and I really am thankful to Kevin and to Jessica for this forum, because I mean, gosh, oh my gosh, the California Department of Public Health, that's huge, right? And so to be able to share our story here is great. And then also I tend to try to bring students with me, but go on podcasts, you know, do interviews, to kind of tell the story about these things that need to be done and to show people. And then what I usually tell my students is, if it's meant to happen, it will be easy. And if you can show people how easy it is, then you're a master at it, right? And so an example is the paper that Riley and Elizabeth, mostly Riley wrote and Elizabeth, and I like on the paper too. It just makes our advocacy seem so straightforward. But it wasn't, right? It was kind of like, oh, what do we do today? What do we do today? Okay, Riley, I mean, literally all the testimony was like, Riley, can you testify? You have class. I'm driving my kid home from school, but we were committed to it. I mean, if you ask my 15-year-old, she'll tell you, she knows exactly all the testimonies. But she said, Mommy was driving me home from volleyball, and she had to pull all over the side of the road to go off about lead at the city council meeting, you know? And so, but I think it's one of those things when you know it matters and you know what is at stake, you show up, right? And then that's the power of mentoring, because you can teach these students when it's important, and students and the public will respond to that. So next slide. Yeah, so takeaway points, I would say, so thank you for letting me, I could go on and on about lead, and I would love to talk all the time with Riley, but he's since left us, so I have to find other people to replace Riley. And we have some wonderful students. But takeaway points I wanted to say, kind of concentrating on lead pollution, is that for environmental harms, including lead, which is so important for us to continue to whittle away at, and what we do in California makes a huge difference, because I'm linked with all the climate people in the country. And with climate, it's the same thing, and especially with lead. If we can get it done in California, the rest of the country follows, and that's the power. And I think what I realized is San Diego, we can do in San Diego, than the other areas. So an example is we did it in Montgomery Gibbs, and so I just heard from Vanessa Forsyth, who's actually called in. Hey, Vanessa, that we can probably do this in San Diego County level, because there are other little airports in our area. So I'm going to try to partner with Vanessa. We have a team of about 5 pre-medical students now that are interested in working on this. So mentoring is a powerful way to address environmental health harms. Reach out for help. I've rarely had anyone say no when you actually can explain to them why it's important, especially when it's not, we're not monetarily benefiting from this at all, right? Like I'm paid for my clinical time. Advocacy is just something I do on the side. And if people can't help out, they'll usually give you in contact of someone who can. And the worst they can say is no, right? You're trying to do something good for the world. Writing, speaking, social media are so important. I think a lot of what happened with me and my journey in the last 4 years is that I just actually started blogging. I started writing. I found my voice, and that the power, the ability to communicate is so important. So getting someone like Riley, who's very articulate, economics major, can straddle that space in between, like the clinical medicine with policy with economics, is very powerful. Involve in students when you can, especially give opportunities, because if you help someone's children or someone special in that community, gosh, now you've earned the trust of that whole community. And I particularly try to reach out to those in environmental justice communities, and stay fun and be connected. And so I think if you can, I hopefully you've gotten from this talk that it's such joyful work. Like I'm here, I'm so happy to be here. Like, this is going to totally fill me up today. To be able to connect with you. So I hope that you find joy today. And I'm so happy to have connected with everyone here. The next slide. Yes, and then it's funny, I talk about wellness a lot, and I am so grateful for everything. And if you follow me on Instagram, like I am really a crazy climate person. Lead is something I do I think it's my thing I need to do. So literally, because I started cleaning up the beach, I thought to myself, I'm going to clean the air. I'm going to clean the water. But it sounds crazy, but what I tell Riley, the students, the medical students, is that you are enough, because we can't wait, right? We waited so long on lead. And if you kind of think of it as like Riley's words were so powerful in his op-ed, it's a immediate present danger that is dangerous today. So if we wait every day, there's more lead going and becoming a pediatric neurotoxin to kids' brains. And I'm enough and you're enough. And this is some of my other trash art. Next slide. I think that's it. Yeah, so thank you so much. We're so excited, and we're at 1:37, so I'm happy to answer any questions, and especially giving Riley a chance to kind of talk about his amazing work.
Thank you all.